one.
Okay, so in summary, look at that strap on your ceiling lift daily, because if you're waiting for anybody to tell you how often these things have to be checked or replaced, you'll be waiting until hell freezes over. Now we also can talk about, when we talk about equipment, we can also talk about wheelchairs. If you have ALS, get the wheelchair with all the bells and whistles while you can initially. Because this disease, it can move rapidly, and sometimes it can take years to move rapidly. But if you are unfortunate as me, where it's moving rapidly, you want to be able to have a tilt function, or you can take the weight off certain parts of your body if you're stuck in a chair. And you want to have robotic legs that go up and down so you can keep the swelling down in your feet. And you want to have little cushions on the edge of your leg supports to keep your legs in place so they don't go outward. What happens is, if you're paralyzed, as the disease progresses, your legs start turning outwards. And so you want to try to keep your legs as straight as you can, because it puts unnecessary pain and tear on the joints. So again, get the chair with the most bells and whistles possible. And
that's a comfy chair.
also,
It's my chair.
when we're talking
to
about
Oh.
care, currently Ontario Healthcare will provide personal service workers to help you in the house. Now, when they commence their help in the house, they will want to give you the bare minimum. I found that out the hard way. We had to fight tooth and nail, didn't we, hubby, to get the personal service workers in?
Yeah. It's not, it always comes with a price. Nothing is ever told to what you have to do, and you have to fight for everything you're entitled to. They won't tell you how many hours you get. They don't tell you how many personal service workers you get. And it's just an argument and a fight with the PSW workers. And they don't know how half of the things on the chair and everything else. 9 times out of 10, when they're first starting to lift the chair, they usually rip the arms off because they don't have the sling in the right spot. They don't watch to make sure the things are clear and everything else. So you got to be very due diligent yourself, even though your PSW workers are you think are trained, because if you don't, they'll just tear your arms off the chair. I don't know. We've had these arms removed 5 or 6 times already.
But the main thing is, just you've got to be aware that the government, as far as healthcare, when you're trying to stay in the home as your terminal, especially with ALS, they'll give you the minimum help required. Most people, they don't know any better, so they don't know what to ask for. The bottom line is, you want to ask for 2 personal service workers 3 times a day for 1 hour. So that's morning, noon, and night. If they try to give you 1 or they try to give you 2 hours, stand pat and say that you want to have the 3 hours a day. The next thing that we found out the hard way is a lot of these personal service workers are contracted out, and they have no experience with ALS, none whatsoever. My current personal service workers, I'm the only patient they have with ALS. So ask for the same PSWs regularly. Don't let them give you a new one each time, because it's very difficult to explain to them when you have trouble talking how your limbs will drop like cement blocks. And when they're not, if they're dropped, it feels like it's going to pull right out of your socket. So make sure you have the same PSWs. Ask for that. Demand that. Because otherwise you'll get a mixed bunch of them coming all the time and you'll be going through a lot of pain and discomfort.
And weekends.
The next thing is also that we just found out, I've been home for 6 months. And we only found out about a month ago, after making several inquiries, that you can also be entitled to receive
Caregivers
respite.
hours to respite, they call it. Caregivers respite, and that is entitled to 3 hours a day for the caregiver. So you can go out and
3 hours a week.
3 hours a week, so you can go out and go for coffee or just do something for yourself. Go out and maybe just get a haircut or whatever. But they do have that, and they won't tell you that. You have to fight for that yourself.
Again, it's not something that's advertised or they offer it unless you specifically say, I'd like to have the 3 hours a week respite care that I'm entitled to have from you. They won't provide it to you. So this gives your caregiver, if you're as lucky as I am to have a spouse that's your caregiver 24/7, this allows them to have a bit of a break, and the government will cover those 3 hours a week, which is important. The next thing is to tell you is also in regards to trying to feel a little better, and that is you can put on muscle stimulants. Right, Lloyd? You can get them at Shoppers.
Shoppers, it's called I think it's called the Revolution. It's a little disc that comes and you can put your feet on it. They also come with arm pads, like gloves, to put on your gloves to stimulate your gloves, and also you can do tensor bands too for different parts of your body too. Some pads for stimulating your muscles there too.
Right, and that helps with circulation, because when your muscles aren't functioning, you find that you'll start getting swelling and everything, and it will pool.
So how much is it?
So this is something that can help with that. It does alleviate it. The other thing is, my arms are starting to, well, my arms are pretty well gone now. The muscles loss is traveling from the lower part to the upper part of the body. So what you find is if you have a really swollen arm, you just compress it, right? Lloyd, you give it a really
Give
tight...
it a real tight push, and it'll go
and
back to
stroke,
normal.
And stroke it.
And then
Stroke
keep stroking
the area.
up, and that'll get rid of the fluid buildup. Because what it is the decaying muscle that's causing this. And you just keep stirring it right up to the arm and everything else. And that will take away the bloat in your arms and everything else.
That will take away the bloating, and that does help. And then, as I said, don't count on the ALS Society to give you a good group of people to speak to and talk to about similar ailments or symptoms, because we've gone to various meetings and we have yet to find any type of support group. I'm hoping that a support group can be put together by concerned caregivers.
To help people when they get diagnosed later down the line, to maybe mentor them and what to look for and help these people, because we went in totally blind, and everything we learned was pretty much on our own by trial and error. And I think there should be some kind of advocacy group or something like that to help these poor people out. The ALS Society come in, and the first day you're diagnosed, they come in, you think, oh man, these people are here for me, it's a great society and everything else. But then that's it. You don't see any more follow-up, you don't see anything else, and you're left on your own to figure everything out yourself.
Right.
And I think there's got to be a network for some people that are getting into this. Luckily, we're two people that believe in standing up for ourselves and going after and asking questions why. But I know a lot of people don't. They just take everything for granted. And I'm just wondering how these poor people are making out. So there should be some kind of advocacy group, and don't rely on the ALS Society, because they don't give you a lot of help.
They don't. And everything through the government is always assessed from an OT, and that's an occupational therapist. So if you are unfortunate and have ALS, and it's pretty advanced like mine, or even if it's in the beginning stages, ask for an occupational therapist. occupational therapist that has experience with ALS because it will make your transition for equipment one heck of a lot smoother. Again, my occupational therapist that was appointed by the government, in 20 years, I'm her third ALS patient. So it's important to get somebody with experience. Ask for this. Don't just assume they'll have it.
ALS is a different disease than other like MS and everything else, and people have to be aware of what the disease is. It's decaying a muscle. Everything has nerves. Like they have nerves in their arms and everything. You can feel everything. They just can't do anything about it because they can't move their limbs. And if you don't have somebody that's had any experience dealing with ALS, how can a caregiver possibly know what they need? They never worked with it. Everybody's needs are different because ALS strikes people in different ways. So there's got to be, stick up for your guns and get somebody who's had a lot of dealings with ALS. And that way your occupational therapist will be able to get your proper equipment faster, so it alleviates a lot of suffering and a lot of wasted time.
That's right. And when it comes to breathing, if you're having trouble with breathing, have a cool environment. Heat is harder to breathe in. That's common sense. If you're having trouble catching your breath, fans directly. Fans will help give you an easier time to breathe. And the last thing is, the doctors are well-intentioned, but they're all...
Always have a pug on your lap, too.
Pugs are very therapeutic.
Ruby's
Yeah.
hanging on for
She's hanging on.
She's skydiving.
It's hard.
No,
It's hard not. It's, you know, you've got to have a sense of humor.
she wants the leg up, I think.
But the dog here has been great company, and when you see her face every now and then, it just cracks you up. But I can't remember what my train of thought was, what I started saying. Can you?
I've lost it.
Jeez.
Anyway, it doesn't matter, but
No, you're talking about
fight for two.
experienced.
You know, fight for the right person.
Right, experienced
ALS help.
Yeah,
PSWs.
get the experienced helpers,
that-
and the doctors will
that's
try.
Oh,
to
the
help
doctors.
you.
The doctors do their best,
The
but
doctors try very, very hard to help you, the palliative care doctors, but what they want to do, they want to give you lots of morphine and everything to help you breathe. One thing with ALS is when you become advanced with it, is you may lose your muscle function throughout your body, but you still have your mind. So unless you're in a lot of pain, and you want to feel stoned all the time, don't take the medication, morphine, unless you really have to.
right.
Otherwise, the other downside of the morphine is it will turn your bowel excrement into cement, and you'll need suppositories or dynamite to get free of that.
TNT specialist.
Exactly, seriously. So use it when required, but otherwise try to refrain from doing so. And you'll spend more quality time at home with your loved ones.